The Allen's test is an assessment of circulation of the arteries of the hand. The test is administered with the patient seated and their arm raised above the heart. The examiner blocks the radial and ulnar arteries at the wrist with his thumbs. The fingers are then repeatedly flexed and extended to rid the blood from the hand. The examiner then releases the radial artery while keeping the ulnar artery occluded. Observe the time required for normal color to return to the hand. The test is then repeated with the examiner releasing the ulnar artery and keeping the radial artery occluded.
The patient is seated for this test, and the arm is elevated above the heart level. The examiner then occludes the radial and the ulnar arteries, and the patient flexes and extends their fingers 10 times. The examiner then releases the ulnar artery and observe the time that it takes for color to return to the hand. The test is then repeated. This time, the examiner releases the radial artery. Note the time that it takes for color to return to the hand. Normal is about 5 to 10 seconds.
Okay. This test can also be performed on any of the fingers. The examiner occludes the radial and ulnar digital arteries at the distal end and slides proximally, keeping the arteries occluded. The examiner then releases the ulnar digital artery while keeping the other occluded. The test is then repeated while releasing the radial digital artery. Observe the time for normal color to return.